Hello, I'm Dr. E. Barry Gordon. This is the 14th video in my series on testosterone deficiency and the second one on osteoporosis. As a suggestion, it might be a good idea for most of you to have a second look at the first video on osteoporosis before watching this one. In the previous video, we saw how absurd and nonsensical current popular opinion and professional advice about osteoporosis really is once you take basic anatomy and physiology into account and apply some simple logic and common sense. Testosterone loss beginning between the ages of 25 and 35 is probably the only cause of osteoporosis, but if not, it's certainly the most important by far. Other than basic anatomy and physiology and common sense, is there any other evidence that testosterone loss is the cause of osteoporosis? We could consider comparing hormones. As I mentioned in an earlier video, almost every effect of testosterone on the human body is the exact opposite of cortisone. And cortisone, in high doses, very actively promotes severe osteoporosis. From that alone, it would be a logical assumption that testosterone should help osteoporosis. Can we evaluate the effect of testosterone on bones by comparing two groups of people who naturally have vastly different amounts of testosterone? Yes, we can. Men and women. It's kind of obvious that the presence of more testosterone makes bones stronger. There's much better evidence. Very few men develop significant osteoporosis at the age that women do. They have much more testosterone in them at almost any given age. They often develop osteoporosis, however, when they're very old and have lost almost all their testosterone. Here's a key question. Are there any men who have serious problems with osteoporosis at a younger age? Yes, there are. Men who have been severely depleted of testosterone as part of their treatment for prostate cancer. Osteoporosis is a well-recognized complication of this treatment. Think about this. There's no controversy. The loss of testosterone in these men, down to levels seen in women, is well documented to cause osteoporosis. And still, bones in women who are healthy aside from their hormone deficiency are left to rot. Other than my descriptions at the beginning of the previous video, what are the consequences of osteoporosis? There are 1.5 million osteoporosis-related fractures every year. This includes 700,000 vertebral fractures and 300,000 hip fractures. Those numbers are going to climb rapidly as the population ages. 20% of women, 1 in 5, suffering a hip fracture dies within a year. Another 25% who were previously independent will require a nursing home for at least 1 year. The National Institute of Health says that 1/4 of the men and 1/2 the women over 50 will eventually break a bone because of osteoporosis. The National Osteoporosis Foundation estimates the cost of osteoporosis-related fractures to be $14 to $19 billion a year. A year's worth of replacement for testosterone for a woman would cost about $28. When it comes to treatment, sadly, not one of the websites I visited ever uses the word testosterone. They all start treatment discussion by recommending an increased intake of calcium. Worthless. Having said that, I'm more in favor of women taking calcium and vitamin D than most doctors. As a matter of fact, I insist on it. When a woman's testosterone replacement starts to work and their osteoblasts begin laying down protein strands for new bone honeycomb, they need plenty of calcium to cement it up. Recent years have seen several new drugs come on the market to treat osteoporosis. Fosamax, Boniva, and the newer reclassed, among others, are all biphosphonates, and they do work. They don't, however, stimulate the osteoblasts to make new bone. Instead, they inactivate the bone-eating osteoclasts, which, by the way, are just doing their job. Biphosphonate treatment usually results in some improvement in osteoporosis, but not, I think, nearly to the degree of testosterone replacement. Remember, Bone destruction is not the primary problem leading to osteoporosis. Lack of regeneration is. So these drugs are not fixing the basic problem, and they certainly don't stimulate the remodeling that is required for truly healthy bones. When it comes to treatment with testosterone, the medical literature has many studies showing the beneficial effects of testosterone replacement on osteoporosis. Unfortunately, as I've stated in many earlier videos, these studies suffer greatly from the gross underdiagnosis of testosterone deficiency and something much less than the best method of testosterone replacement. Let's look at the differences between the biphosphonates and testosterone. Biphosphonates have been on the market for maybe 5, 6, 7 years. Testosterone has been on the market for over a half a century. Using biphosphonates puts a foreign chemical into your bones. Replacing testosterone restores a vital hormone your body used to produce in abundance when you were younger and stronger and healthier. Biphosphonates decrease bone destruction. Testosterone stimulates bone rebuilding. Biphosphonates do nothing more than help osteoporosis. Reversing osteoporosis is only one of many, many beneficial effects of replacing testosterone. There are many reported side effects to biphosphonates. I found lawyers' websites advertising for victims on a Fosamax search. That's their word, not mine, and I certainly don't agree with it. But there's no credible significant side effects to testosterone replacement. And once again, a year's worth of testosterone for a woman cost about $28. This painful, deforming, debilitating, and often fatal disease of osteoporosis can be prevented or reversed by simply providing the body with what it so desperately wants and needs: testosterone, the hormone that made bones grow and become strong in the first place. Learn more about testosterone deficiency by going to my website, www.thehiddendisease.com. Abstracts of over 70 medical studies are posted there, as well as all previously released videos in this series. My next 2 videos will take up a subject almost as vital and common to men as osteoporosis is to women: prostate cancer. Please remember to spread the word about the existence of this disease. Email the video links to everyone you know and ask them to do the same. I'm Dr. E. Barry Gordon. Thank you for watching.